Good evening. Chair calls to order legislative session day 20-018. I would ask you all to please stand for the pledge, followed by tonight's opening prayer by Councilman Jan Giordano. Pledge allegiance to the flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Councilman, you need to unmute your mic.
That would help. Lord, bless us as we meet together. Thank you for this past weekend as we remember those who sacrificed their lives for our freedom. We come to you asking for guidance, wisdom, and support as we gather tonight. May this meeting bring success and growth to our council. We thank you for this precious time and that you have given us. Amen.
Amen. Agenda item number 4, special presentations. Dr. Moy, Harford County Health Officer. Good evening, sir. It's good to hear from you again.
Good evening. Good to be here. So thank you, Council President Vincente and County Council members. Appreciate the opportunity to give you another update on the COVID-19 situation. The COVID numbers as of this morning, worldwide, 5.5 million cases, 348,000 deaths. In the United States, 1.6 million cases with 98,000 deaths. In Maryland, 47,687 cases with 2,217 confirmed deaths. And in Harford County, 795 cases with 45 confirmed deaths. A closer look at the Harford County specific age data as of yesterday shows that those between the ages of 18 and 64 make up 69% of the COVID cases, but account for only 6% of the deaths. And those age 65 or older make up 30% of the cases, but account for 94% of the deaths in Harford County. And for those under age 18 in Harford County, so far they account for only 1% of the cases and no deaths. A closer look at the Harford County specific nursing home data shows that nursing home resident and staff COVID cases make up 29% of the county's COVID cases, but they make up 53% of the county's COVID deaths. So this confirms our understanding that although everyone is at risk for getting COVID, it's those who are at higher risk, including older people and those with underlying medical conditions that are more likely to die from the virus. Having said that, as mentioned last week, the CDC has identified a new COVID-related condition in children. Now it's termed multi-system inflammatory syndrome in children, where different body parts can become inflamed, including the heart, lungs, kidney, brain, and the gastrointestinal system. So far, there have been 6 cases identified in Maryland with no deaths yet. So COVID-19 can definitely affect people of all ages. Last week at our Board of Health, at our County Council meeting, we compared the COVID numbers among Maryland's 24 jurisdictions and saw that Harford had numbers better than most comparably sized jurisdictions. And that gave us some confidence that our county was ready for the stage 1 reopening that started statewide on May 15th. Today we updated those numbers because we need to track this metric as a key indicator for how we're doing. So as of today, May 26th, Harford County continues to have a low number of COVID cases per 100,000 population and a low number of COVID deaths per 100,000 population for the 11 largest Maryland jurisdictions that have at least 700 COVID cases. Right now, Harford County's COVID death rate is 18 per 100,000 population, and that's compared with the Maryland state average of 36 per 100,000 population. But our number of COVID deaths have increased in just 1 week from 32 confirmed deaths to 45 confirmed deaths this week. So we need to keep a close eye on this number, especially as the reopening plans progress. We need to see if this was a 1 week fluke or if this begins a trend. We need to watch these numbers very closely. And you can still expect to see the number of cases and the number of deaths increase, but we just need to see how it trends. Now that the COVID virus is about 5 months old, there's still a lot unknown about the virus, but there are some things we do know. It's probably a good idea to review some of those basic points. First, we know the virus is extremely contagious, partly because asymptomatic persons, people without symptoms, can spread the virus at least a full 48 hours before they themselves show symptoms. So as mentioned in a previous update, researchers used to think the person with COVID could pass it on to 2 to 3 others. More recent study shows that that number is higher, and that occurs only if no social distancing practices are being followed. By comparison, someone with the flu can probably only give it to an average of 1 to 2 others. Second, a large percentage of people with COVID-19, possibly up to 50% of people, are unaware they have the virus, and they're walking around having no idea they are spreading the virus to others. So in fact, there was a recent study from New York Presbyterian Columbia University Hospital, where because of the high prevalence of COVID in New York, they decided to universally screen all pregnant women admitted to their labor and delivery. They found that 15% of all their patients tested positive for COVID, but that 88% of those women who tested positive had no symptoms and had no idea that they had COVID. That means that 13.5%, which is 88% times 15%, that's 1 in 8 patients who are relatively young and healthy are probably walking around in the general population infected with COVID with no symptoms and with no idea they are spreading the virus around the community. So the lesson learned from this is that those carriers without symptoms make it even more important that all people wear face masks when in public. Third point I want to make is, so let's review one more time, how does this virus spread? The CDC just updated last week its COVID-19 transmission webpage to clarify what they've learned in just recent weeks about how the virus spreads. They stated, quote, "The primary and most important mode of transmission for COVID-19 is through close contact from person to person. Based on data from lab studies on COVID-19, it may be possible that a person can get COVID-19 by touching a surface or object that has a virus on it, and then touching their own mouth, nose, or eyes, but that is not thought to be the main way the virus spreads." So basically, COVID spreads first through respiratory droplets when an infected person coughs or sneezes from a person who is within 6 feet, or aerosolized transmission of the virus when an infected person just talks or breathes in an enclosed space, because the virus can live as an aerosol in the air for up to 3 hours. And this may be a more common mode of transmission, even more so than possibly surface transmission. So, despite knowing these things, there's a lot still unknown about COVID-19, and one question is, why do some COVID-19 patients infect many others, while most don't spread the virus as much? So as mentioned, much of the discussion before about COVID spread has focused on the R number, the average number of new infections caused by each patient. But there's another number, known as the dispersion factor, or the K number, which describes how much a disease clusters. So instead of focusing on just one person spreading to one person, with COVID-19 researchers have noticed is that there are super spreaders, where one person can spread it greatly to a cluster of people. The lower the K number, the more a role that clusters of infections play, the more a role that super spreaders play in spreading the virus. So an example of super spreading events for COVID, a big example recently was a published study in the CDC report where a church choir met in Washington State in March, in which there was one person with some cold-like symptoms. So that after a 2.5 hour choir practice, involving 61 persons. The whole thing turned into a large outbreak, a cluster in which 52 of the 61 persons got sick. That's an attack rate of 87%. 3 of those persons were hospitalized and 2 died. This was analyzed all in great detail in the CDC report. Other examples of a super spreading event was an outbreak in a dormitory for migrant workers in Singapore linked to 800 cases. There was a cluster of 65 cases from a Zumba class in South Korea. There were 80 infections linked to a live music event in Japan. So why do these COVID infection clusters, why do they cluster more than other viruses is the unanswered question. So here's some possible reasons. First, COVID-19's mode of transmission, mostly through droplets. As we mentioned, we now know that transmission can occur through aerosolization, so that finer aerosols can stay suspended in the air for up to 3 hours, allowing one person to affect many others. Second, individual patient characteristics can play a role too. So some folks can shed the virus for longer periods of time and a larger load of virus. And it could be because of differences in their metabolic or their immune systems. A 2019 study of healthy people showed that some breathe out many more particles than others when they talk, especially if they talk at a loud volume. And then third has to do with the location of where these COVID clusters are likely to occur. Clusters are more likely to occur in enclosed indoor spaces rather than outdoor spaces. One study showed that of 318 identified clusters identified over a 1-month period, only 1 cluster occurred outdoors. Another study showed that the risk of infection indoors is almost 19 times higher than outdoors. So there's some venues that are particularly risky. For example, meatpacking plants are vulnerable locations because many people work closely together in spaces where there are low temperatures, and that helps the virus survive. Loud places are also vulnerable places, like places where there's a lot of singing. So possibly one of the keys to addressing COVID-19 in the future is to identify where clusters are most likely to occur and to target those venues with preventive measures versus shutting down all venues. So we can figure out how to target those high-risk venues. The only tool we have, especially if these numbers worsen, is an across-the-board shutdown, which is an incredibly blunt tool that most people will find hard to tolerate. So since stage 1 of the reopening plan opened on May 15th, there have been a lot of questions because there are a lot of gray areas for interpretation with these rules. And we ourselves are still waiting for interpretive guidance from the state. In the meantime, when people ask us for our advice, and a lot of people are asking us for advice, my response is usually the following. You know that this is an extremely contagious disease that primarily affects older people and people with underlying medical conditions, but it can affect people of all ages. You know that one of the reasons is it's so contagious because asymptomatic people can carry this virus. Possibly as high as 1 in 8 persons can transmit the virus without knowing they themselves are infected. Another reason it's so contagious is because it can be spread through aerosolization. Sorry about that. With aerosol particles suspended in the air for up to 3 hours, and that's why the CDC is recommending that people wear masks whenever they are out in public. And finally, you know, there are certain venues that are riskier than others, such as contained indoor spaces with colder temperatures, a high density of people, a lot of loud talking or loud singing. With those factors in mind, and within the governor's orders and recommendations, we tell people they need to use their own best judgment about how much risk they choose or choose not to take in any given situation. We consider public health's role is to just help people identify and manage those risks, then follow the broader community metrics like we have been doing with the cases per capita and deaths per capita. That helps us monitor how the situation is going in Harford County. And with that update, be happy to answer any questions.
Thank you, Dr. Moy. Councilman Giordano.
Good evening, Dr. Moy. Thank you very much for giving us an update. I do have a few questions. My first question is that I understood you said that it can be airborne for 3 hours. I'm assuming that's inside, not outside. And that means that multiple people can be in that space having exhaled or whatever. Maybe they didn't have a mask on. But if you have a mask on, that's still not going to protect you if that virus is in the air up to the last 3 hours. Would that be correct?
That's correct. And so the main purpose for wearing a mask is it does not give you that much protection. What it does is it prevents the person who might be infected from spreading the aerosol or the droplets as much. And it doesn't stop it completely. It just reduces the spread. So it's mainly to prevent the sick person from infecting others that much more easily. It doesn't really protect people who are around them that much.
Okay. Second question is this COVID-19 have any similarities with the pandemic of 68, where 100,000 Americans died from the flu and then it mutated out and died? Mostly older people. Any similarities between the two, or?
So what they do, because this is a new virus, they're looking at all of those past pandemics. So there was one in 68, there was one in, I think, 1958. They're looking at one in 1918. So some of those pandemics were influenza, H1N1, those kinds of flus. The coronavirus was the one that they're looking at. That's more associated with SARS and MERS and those things. So they're thinking there may be similarities, but that's the problem, is that they're not sure. They're not sure exactly how similar they are to all these things. One of the hopes is that during warm weather and humid weather, other viruses have sort of tamped down. They're hoping that happens. I think there are some studies that shows that heat and humidity kind of softens the blow of this virus. They're really hoping that happens. No one is sure. They just don't know yet.
Okay. Thank you. Third and final question. You said one of the largest areas was meat packing plants. Can the virus get on the meat that people are eating? I think that's a big question people want to know, is if they're buying meat in a store or butcher shop or wherever, if people were infected in there, can it get on the meat and then those people get infected by eating the meat?
So the way the CDC words all their wording is they're looking at the primary mode of transmission, and then they're saying theoretically there could be other modes of transmission, but those other ways are not the primary mode. And they are saying that eating it, ingesting it, that's not a primary mode of transmission. Now, can there be COVID in meat? Possibly, but they're not saying that that is a primary mode of transmission. What they're saying is in meatpacking places, first is cold, and cold is conducive to this virus probably staying alive. Secondly, you have a lot of workers and they're close in together, and then also sometimes these workers they come from other places and they live together. So it's not just that they're together in the plant; they might actually be living together when they go home. So you got a lot of factors there. And they're thinking that it's primarily the respiratory droplets and the aerosol, not so much the virus getting onto the meat as a primary mode of transmission. So they're not, CDC is not saying that is the main mechanism.
Okay. Hey, Dr. Moore, do you think Brazil, the reason their numbers are going up is because they're going into the fall, coming out of their summer months, since they're reverse of us?
So no, I don't think anybody knows for sure, but that's very possible. It could have to do with seasonality, but it could also be due to relaxing social distancing measures. So there's just so many factors. It's hard to say.
Okay. Thank you very much, Dr. Moore. I appreciate the update and all the information, and keep us informed. It's very informative.
Sure. Mm-hmm.
Anyone else? Seeing no one else, Dr. Moy, again, I'm just going to thank you for the job that you do. I want the citizens to fully understand the efforts that you and your partners at the health department are doing to work with all of us, our businesses, the administration, everyone involved to make sure that we're up and running safely and practicing all of the social distancing requirements. So I want to thank you again, and I guess I'll be listening to you in the morning.
Okay, my pleasure. Thank you.
Thank you. Agenda item number 5, approval of minutes, legislative day 20-017, May 19th, 2020. Are there any corrections to the minutes? Seeing none, the minutes stand approved. Council, may I have general consent to take up items 7 through 9 on the agenda and then back to item 6 thereafter? Thank you. Agenda item number 7, introduction and consideration of amendments. Before we get started, after further review and discussion, amendments 73 and 74 to Bill 20-009 have been withdrawn. Mr. Kearney, I don't know if you want to add anything to that or not.
If you want me to, Mr. President.
Please.
Amendment number 74 violated Charter Section 512A, which provides, among other things, that the council shall have no power to change the form of the budget as submitted by the county executive, or to increase any expenditure recommended by the county executive for the current expense or capital purposes. The Aberdeen Activity Center had a budget line item of 0. Moving $500,000 into that was an increase and violated the charter.
Thank you, sir. Mr. Vice President Woods, would you please read amendments 75 through 87 to Bill 20-009?
Thank you, Mr. President. Amendments number 75 through 87 to Bill 20-009, Annual Budget Appropriations Ordinance, introduced by Council President Vincini at the request of the County Executive. Amendment number 75, page 38 in line 9, strike 32 million and substitute 32,160,000. Amendment number 76, on page 39 in line 25, strike 32 million and substitute 32,160,000. Amendment number 77, on page 34 between lines 9 and 10, insert the following. Prior PAYGO, 0. Amendment number 78, on page 34 between lines 11 and 12, insert the following. Prior bonds, 0. Amendment number 79, on page 34 in line 15, strike the following. 9,500,000 and substitute 9,500,000. Amendment number 80, on page 36 between line 19 and 20, insert the following. HCPS Facilities Repair Program, 437,185. Amendment number 81, on page 36 between lines 16 and 17, insert the following. Athletic and Recreation Repairs and Improvements, 473,937. Amendment number 82, on page 36 between lines 24 and 25, insert the following. Major HVAC, 1,324,990. Amendment number 83, on page 43 in line 29, strike 144,931,000 and substitute 145,091,000. Amendment number 84, on page 58 in line 17, strike 15,235,000 and substitute 15,355,000. Amendment number 85, on page 58 in line 18, strike 2,900,000 and substitute 2,940,000. Amendment number 86, on page 58 in line 21, strike 32 million and substitute 32,160,000. Amendment number 87, on page 58 in line 22, strike in brackets 32 million and substitute in brackets 32,160,000. Oh, it is. It's in parentheses. Sorry.
Thank you, Mr. Woods. May I have a motion to approve voting block 10, which contains amendments 75 through 76?
Motion.
Second.
Thank you, Mr. Buell and Mr. Woods. Move to second to approve amendments 75 and 76. Is there any discussion? Ms. Dixon.
Mr. President,
Aye.
Mr. Johnson,
Aye.
Mr. Woods,
Aye.
Mr. Giangiordano,
Aye.
Mr. Schroeds,
Aye.
Mr. Wagner,
Aye.
Mr. Beulah.
Aye.
Being 7 votes in the affirmative, 0 in the negative, voting block 10 to Bill 20-009 is hereby approved. May I have a motion to approve voting block 11, which contains amendments 77 through 83? I'm sorry? Okay.
So moved.
Thank you, Mr. Schroeds. You need a second?
Second.
Thank you, Mr. Woods. It is seconded to approve voting block 10, yes. Voting block 11, which contains amendment 77 through 83. Is there any discussion? Seeing none, Ms. Dixon?
Mr. President,
Aye.
Mr. Johnson,
Aye.
Mr. Woods,
Aye.
Mr. Giangiordano,
Aye.
Mr. Schroeds,
Aye.
Mr. Wagner,
Aye.
Mr. Beulah.
Aye.
There being 7 votes in the affirmative, 0 in the negative, voting block 11 to Bill 20-009 is hereby approved. May I have a motion to approve voting block 12, which contains amendments 84 to 87?
So moved.
Thank you, Mr. Beulah.
Second.
Thank you, Mr. Schroeds. Moved and seconded to approve voting block 12. Is there any discussion? Ms. Dixon?
Mr. President,
Aye.
Mr. Johnson,
Aye.
Mr. Woods,
Aye.
Mr. Giangiordano,
Aye.
Mr. Schroeds,
Aye.
Mr. Wagner,
Aye.
Mr. Beulah.
Aye.
There being 7 votes in the affirmative, 0 in the negative, voting block 12 to Bill 20-009 is hereby approved. Agenda item number 8, call for final reading of bills. Bill 20-009, annual budget appropriation ordinance as amended. May I have a motion?
Mr. President,
Mr. Woods,
I move to approve Bill 20-009 as amended.
you have a second?
Second.
Thank you, Mr. Schroeds. Moved and seconded to approve Bill 20-009. Is there any discussion? Ms. Dixon?
Mr. President,
Aye.
Mr. Johnson,
Aye.
Mr. Woods,
Aye.
Mr. Giangiordano,
Aye.
Mr. Schroeds,
Aye.
Mr. Wagner,
Aye.
Mr. Beulah.
Aye.
There being 7 votes in the affirmative, 0 in the negative, Bill 20-009 as amended is hereby approved. Agenda item number 9, enrollment of bills. The enrolled copy of Bill 20-009, the annual budget appropriation ordinance as amended, is certified as being the text finally passed. Agenda item number 6, introduction and consideration resolutions. And again, memorandum of change 2 and 3 to resolution 014-20 after further review and discussion have been withdrawn. Resolution 014-20, fiscal year 21 capital improvement program as amended. May I have a motion?
Mr. President,
Mr. Woods,
I move to approve Resolution 14-20 as amended.
Thank you. Thank you, Mr. Schroeds. Moved and seconded to approve Resolution 014-20. Is there any discussion? Ms. Dixon?
Mr. President,
Aye.
Mr. Johnson,
Aye.
Mr. Woods, Mr. Giangiordano,
Aye.
Mr. Schroeds,
Aye.
Mr. Wagner,
Aye.
Mr. Beulah.
Aye.
There being 7 votes in the affirmative and 0 in the negative, Resolution 014-20, Fiscal Year 21 Capital Improvement Program, as amended, is hereby approved. Resolution 013-20, adoption of property tax rate. May I have a motion?
Mr. President,
Mr. Woods,
move to approve Resolution 013-20.
may I have a second? Thank you, Mr. Schroeds. Moved and seconded to approve Resolution 013-20. Is there any discussion? Mr. Wagner?
I think it's appropriate to mention the fact that this is basically a state initiative that imposes the property tax rate at that level. We're adopting it. However, the current budget we have before us is linked to this with a whole lot of initiatives that none of us can argue with. You know, the sheriff's office, their wage package, the final phase of that, and certainly some of the education money's coming out of that. So the $3 million that this raises, or $3 million plus, is pretty crucial to a whole lot of things that are important to all of us, even though we struggle with the possibility of a slight increase in the property tax that may equate to $30, $40 per year per household. But in the end, the benefit seems to outweigh what the small increase it would be. So I just wanted to point out the fact that it is linked to things that are already included within this FY21 budget. Thanks.
Thank you, sir. Anyone else? Ms. Dixon?
Mr. President,
Aye.
Mr. Johnson,
Aye.
Mr. Woods,
Aye.
Mr. Giangiordano,
Aye.
Mr. Schroeds,
Aye.
Mr. Wagner,
Aye.
Mr. Beulah.
Aye.
There being 7 votes in the affirmative and 0 in the negative, Resolution 013-20, adoption of property tax rate, is hereby approved. Agenda item number 10, business from the president. I want to commend and thank County Executive Glassman for presenting us with a budget that addresses education, our sheriff's deputies, fire and EMS, all of our partners in public safety, and our county employees, and much, much more. So with all of the uncertainty surrounding the COVID-19 pandemic and its impact and effect on our revenue projections, my colleagues and I stand ready to work with the county executive to make any adjustments needed throughout the next year. With that, Mr. Johnson.
Thank you, Council President. I just want to say tonight, you know, with the COVID-19 still going on, it doesn't hit home, or it doesn't strike you until it hits home. I just found out tonight that 2 of my family members have the virus, and one of my family members is on oxygen. They're home. They're doing fairly well, but they're on oxygen. So, you know, with us reopening and you know, getting back to work and everything, we have to still be mindful that this virus, this disease, is still out there, and it doesn't care what zip code, what your demographics are, or anything like that. It can strike out of nowhere, and we all still need to be safe and, you know, adhere to the governor's mandates. So with that being said, I'll yield my time back tonight.
Thank you, Mr. Johnson. Mr. Woods.
Thank you, Mr. President. Council, I really want to commend each and every one of you and everyone that helped us for working on this budget. It was an interesting time doing it in the manner that we did, but I'm very proud of this council for the work that each of you put in, all of us together, for being so separated and we're still all together. I want to thank all the people, our community that helped us with this, and of course the administration. They were there to answer every single question I had. Can't thank them enough for that. So I believe they put together a very good budget, and I'm curious and hopeful that it works out through the rest of the year. But once again, I just want to thank everyone involved and thank the entire council team for being such a great team working together to pass a successful budget. Thank you.
Thank you, Mr. Woods. Mr. Jan Giordano.
Thank you, Council President. I just want to congratulate the seniors at Patterson Mill High School and Bel Air High School. I think last year was my first chance to go back to my alma mater, Bel Air, and speak. I would have never have thought that when I graduated high school. So for all the seniors that are graduating, you never know where you're going to be 20, 30, 40 years down the road. Just, things took a little twist this year. Hopefully you get back on track and everything works out. And I want to thank all my council colleagues, the staff, in the office, and everybody for their concerns for my back surgery. I'm finally feeling a lot better. It's been a tough month, but I do appreciate everybody's concerns. Lost 30 pounds, not the way you want to do it, but I do feel much better, and thank you for everybody checking on me. I really appreciate it. Thank you, Council President.
Thank you, Mr. Jan Giordano. Mr. Schroes, before I go to you, I was just advised that I forgot to advertise our audit advisory board meeting here tomorrow evening in this facility. So it'll be virtually, so done virtually. So with that, Mr. Schroes.
Thank you, Council President. First, Councilman Johnson, I just want to let you know I'll keep your family members in my thoughts and prayers. I hope that they conquer this nasty, nasty virus. And, I continue to pray for everybody out there. And I know that together we'll all get through this. Councilman Jan Giordano, you're looking good. I was thinking that you were feeling better. I could tell tonight. So welcome back, and I hope to see you real soon. Next, I just want to congratulate my friends John and Anna Mae Garber, who celebrated their 60th anniversary on May 21st. So I want to wish them many more years of happiness. Also want to congratulate all of our young patriots. I did have an opportunity over the weekend to meet with, of course, social distancing very well, the best we could, with 4 individuals from the Narsville Elementary School 5th grade Patriots. And those are Braden Warfield, Tyler Thompson, Madeline Oshesky, and Mason Oshesky. They have all been dear friends of mine for a long, long time. I remember when each of them were born, and it's hard to believe that they are moving on from 5th grade, but I couldn't be more proud of them and all the Patriots in Harford County, as this is not normal what we're experiencing. It's very difficult, not only for these young folks, but our seniors graduating from both high school and college. They've worked really hard, and they aren't able to participate in many of the celebrations that normally they would be able to. Also want to, again, congratulate all of our Harford County seniors who are graduating. North Harford High School's graduation was scheduled for this morning, and of course that didn't happen. So again, just want to wish them the very best in all of their future endeavors. I know they're going to do wonderful things, and everyone's proved themselves to get through what we're all conquering right now to get through COVID-19. So best wishes to them. Also, just want to thank the county executive for presenting a budget that fully funded education for the first time in many, many years. So the Glassman administration does deserve to be commended on that, as well as all the other parts of the budget, like was said earlier, with our first responders and just lots and lots of things. Of course, we don't know what this year is going to turn out to be and what kind of economic effect that it's going to have. So may be a little bit of a moving target, but I do believe that our residents will understand that. And also, the tax rate was not changed. While the overall tax revenue may have increased, tax rates have been the same for a decade. We have not raised taxes. Actually, during, I think, my second term, we decreased the property tax rate twice. That was one of the first times I remember in history, and we haven't moved that tax rate since then. So I think in Harford County, we have many people that are very good stewards of our funds. We have a credible AAA bond rating by all the rating agencies, and that's why we're borrowing money at a record low rate. And we really have a lot of programs and facilities that I think we're very lucky to have in this great place. So that's all I have to make.
Thank you, Mr. Schroeder. Mr. Wagner.
This budget does go a long way in accomplishing a lot of things that we're all going to be very proud of in years to come, and things that should have been caught up on, which I think this will go a long way in catching up on that. Any shortfalls we see won't be in the upcoming year. It'll be in the next year and possibly the one after that because of the economic downturn due to COVID-19. It's no secret that I was certainly trying to get the Aberdeen Activity Center some money that I wish County Executive Glassman would have thrown that way to have given them a jump start to get that up and going, because I think that goes a long way in helping the Route 40 corridor as well. Anything we can do in the Route 40 corridor to try to build up and help with the community down there all throughout, from Edgewood, Joppatown, Aberdeen, Havre de Grace, all up and down the corridor. And I thought this was certainly one of the pieces that would have helped out. And don't take this as a swipe at the council. I'm just going to tell you that I believe we left $8 to $10 million on the table within this budget. Typically, county executives and administrations always overestimate expenses and underestimate revenues, and this one's no different. If you see what our county auditor had said in several different fiscal analysis, you'll see that I believe she would agree with me, maybe not quite that strong, but I think she'll agree and can justify the dollars that are still on the table. And one thing that would certainly substantiate that is, and if you look back over the last year, the county executive hasn't come to us for movement of money within departments to try to accomplish certain things. That's not necessarily fantastic fiscal accounting. It's the fact that you're a little bit inflated. So you don't have to come to the council to move the money around. It's already within the departments, and you can move it to accomplish what you want to accomplish. I certainly, as you all did, I commend the county executive for being so aggressive in certainly taking care of the sheriff's office and certainly taking care of education and whatever other needs that may have been shorted in past years. And, we'll work with them as well as all of us to try to accomplish these things in the end. On a sad note, I would like to just point out that a longtime county employee that we had, Linda Andrews, has passed away, and she's the wife, longtime wife, I think it's 55 years they were married, of Matt Andrews. Certainly a great Ravens fan, and Linda will be missed by all of her friends and all her colleagues there at the county. Thank you very much.
Thank you, Mr. Wagner. Mr. Beulah.
Thank you, Mr. President. Just a couple of things tonight. In early May, as the chairman of the board of the Sergeant Alfred B. Hilton Memorial Fund Incorporated, I signed a memorandum of understanding with the city of Havre de Grace to erect a monument in honor of Sergeant Alfred B. Hilton, the only Medal of Honor recipient in Harford County. I would like to thank the mayor of Havre de Grace, Mayor Bill Martin, City Council President David Glenn, and all the council members for supporting this effort, as well as the city of Havre de Grace. They're allowing this monument to be erected in Tidings Park next to the World War I Veterans Memorial. So I just want to thank them. and we're looking forward to getting that monument erected there. I would also like to thank the city of Havre de Grace for the amazing job that they do as far as honoring and appreciating our veterans. They continued with this honoring of our veterans yesterday with a Memorial Day ceremony. It was very well attended. Social distancing was in place, as well as wearing masks. It was a simple ceremony, but when a lot of areas decided not to have any type of ceremony, Havre de Grace stepped up to the plate and they had a ceremony. So job well done, City of Havre de Grace, Mayor Bill Martin and the council members. And also I would like to say they did a great job of giving the seniors some recognition by hanging portraits around the city. And I thought that was really great. So great job. And that's all I have, Mr. President.
Thank you, Mr. Beulah. Ms. Dixon, do we have anyone signed up?
Yes, Mr. President, we have one, John Malamo. And he would like to call back this evening.
Malamo.
Good evening, sir. Council President Vincenti, may I have your name and address for the record?
Yes, sir. Good evening to you. John P. Malamo, 2402 Eagle View Drive, Bel Air, Maryland. Continuing on, the drone test facility has a curious lineage. A special exception was granted by the Zoning Board of Appeals on 16 September 2014, and after all appeals exhausted on 14 April 2015, to operate a general aviation airport as a permitted use, a conforming use. The principal permitted use of the property at 3538 Aldino is a general aviation airport. Accordingly, Section 267-88I, parens 2, parens F of the code applies. Appropriate airport accessory uses such as restaurants, snack bars, automobile rental agencies, airline business offices, and service facilities, but not other businesses or industrial uses may be permitted. The drone facility would be an accessory use, a business, and industrial use. Recalling from the site plan approval letter, no accessory uses were approved. Recalling Mr. Killian's 3 May 2018 letter, there seems to be some confusion on roles and responsibilities. Mr. Killian wrote, and quoting, operation of the airport precedes the adoption of the Harford County zoning code. As such, it is recognized as an existing legal non-conforming use on the property. This was affirmed by the zoning hearing examiner in 1997, see Board of Appeals case number 4700, and again in 2014, at which time the airport was granted a special exception, see Board of Appeals case number 5814. Recalling our previous discussion on Maryland law regarding special exceptions for non-conforming use, Mr. Killian's recognition is confusing and inconsistent with Maryland law. Indeed, referring to the Peerage Court, we find this language. Once applied for and granted a special exception for operation, the use began to conform with the overall zoning provisions. Non-conformance becomes conformance, and the zoning ordinance must be strictly construed to eliminate the non-conforming use. 12 February 2019, a permit for a commercial building, an 80 by 80 hangar was requested. 13 February 2019, Planning and Zoning noted there was no 80 by 80 hangar on the approved site plan. 22 February, Planning and Zoning noted that a site plan waiver had been approved. 22 February 2019, a building permit was issued. 25 March 2019, a groundbreaking ceremony for the drone test facility was held at the Harford County Airport. Attendees included Council President Vincenti and Councilman Schroeds, among others. I'm just wondering, does attendance at the groundbreaking ceremony satisfy requirements for a public hearing and a decision by the Zoning Board of Appeals prescribed in the code or the Zoning Board of Appeals rules of procedures? Gentlemen, these discussions are all about governance and government in Harford County. They're about you. Good night.
Good night, sir. Anyone else?
There is no one else signed up, Mr. President.
Thank you. Mr. Johnson, a call afterwards if we can. With nothing else, this meeting will be adjourned.
This meeting is no longer being recorded.